Good morning, everyone.
Hi, guys.
We have a special guest this morning. Somebody wanted to join us finally.
She actually told me she was frisky, and I'm like, oh no, please.
Yeah,
Very
I'm
frisky
gonna
today.
have to keep hitting the censor button here,
Yeah.
maybe. This morning, Joan is going to talk to us about diabetes. She had started on Tuesday, talking about it, and we will conclude it today. Good morning, Diane. Hi, Karen. All right.
Good morning, everyone. So diabetes. 29 million people in the United States have diabetes, and another 86 million have prediabetes. Everything we talked about on Tuesday about the risk factors and all of that with prediabetes is the same as with diabetes. However, the complications are much greater with type 2 diabetes than with prediabetes. Let's talk about how those blood sugars affect. First, let's start with the heart. Over time, high blood sugar damages the small vessels and the nerves in the heart. Diabetes is also known as small vessel disease. In adults with diabetes, the most common cause of death from diabetes is heart attack or stroke. The high sugars affect the small vessels of not just the heart, but also the kidneys, the eyes, the fingers, and the toes. Our bodies were actually designed to supply blood first to our heart, our head, and our kidneys, and everything else last. Like I tell my patients all the time, especially last is the fingers, the toes, the nose, and the penis. Diabetic neuropathy is damage to the nerves whenever I see something go across the screen, I lose my thought. Diabetic neuropathy is damage to the nerves, and it causes a loss of feeling or numbness or even pain in the arms, the hands, the legs, and the feet. There are some symptoms of diabetes, but they often go unnoticed. Things like urinating often, feeling hungry even after you've eaten, feeling thirsty, no energy, blurry vision, cuts that don't heal, mood changes, increased anger for sure, weight changes, and usually this is an increase in weight. There's a great test that you can take that will tell you what your risk is of developing type 2 diabetes, and that is at www.diabetes.org. Take that test. We have two main goals when we're treating diabetes, and those goals are, number one, to make you feel well day to day, and number two is to prevent or delay the long-term problems or comorbidities that occur from diabetes. The best way to do this is plan your meals, being physically active, and take your prescribed medications as they are ordered. How will you know if your treatment plan is working? We call it the ABC of diabetes. A is that A1C that we talked about the other day. That tells you what your blood sugar is for the past 2 to 3 months. Not that snapshot view, which, by the way, changes from minute to minute. The A1C is really the yardstick that we use, okay? And we like to see that number under 6.4%. B is for blood pressure. Remember we talked about that being the force of the blood flow through the blood vessel walls? Well, think about that force in small vessel disease. So it's very important that the blood pressure be lower than in the regular population. I got to get in the screen here. C is for cholesterol, okay? And we know that certain cholesterol causes an increased risk for heart disease. There's different foods that impact your sugar levels differently. Chrissy, did you get to post that?
Yes.
Yeah, okay, you did. I'm not sure how it came out. Did you get to look at how it came out on the website?
No.
It's actually from Dr. Oz, this magazine, which I thought was a great magazine this month, and it explains everything that I'm talking about here. Fiber is probably the best ones and has the lowest impact on your sugar levels. Veggies are a high amount of fiber, and that's why it's always a good choice. Fish and chicken are your next best choice because it impacts your sugar level. Also fats, believe it or not, but it's the good fats, also are not a great impact on your sugar level. There's some carbs, all right, that are good carbs, and those are your unprocessed ones, like steel-cut oats, wild rice. They digest very, very slowly, so the sugar trickles in the bloodstream, and it's not a huge spike. Bear in mind, though, if you eat large quantities of that stuff, you're going to have high sugar levels. The last one that causes the highest spike in your blood sugar levels is processed or simple carbs like white bread, white rice, white pasta, pretzels, sugar, candy, donuts. Those are the worst ones for you. And again, like I said, Chrissy put that up. I'm hoping that it came out good because
we'll
it really...
change it if I'll take it down.
Will you? Yeah. Because it really does show. If you eat a normal diet, typically what Americans eat, it will show you the spikes and the dips, and that's when it really causes damage to those blood vessel walls versus what you should eat. How you have a slow and a steady progression. You have to have sugar in your diet, okay? Glucose is what helps our cells, but you just don't want the rises and falls. That's what causes the damage. This is a huge subject, but like I said in the beginning, look at how many people are affected by it and are going to be affected even more. Tracy's going to share a little story with us today instead of a quote.
All right, so a 24-year-old boy seeing out from the train window shouted, "Dad, look, the trees are going behind." Dad smiled, and a young couple looked at the 24-year-old's childish behavior with pity, and suddenly the boy again exclaimed, "Dad, look, the clouds are running with us." The couple couldn't resist and said to the father, "Why don't you take your son to a good doctor?" The father smiled and said, "I did. We are just coming from the hospital. My son was born blind and just got his eyes today." Don't judge people before you truly know them. The truth will surprise you.
Everyone has a story. Be kind anyway.
All
Chrissy
right.
has an announcement here.
Yes, so I wanted to talk to you guys. We haven't gotten a lot of input on the contest. We need to have more guesses. A couple of people have gotten some of them. Nobody has gotten all of them, which we weren't expecting you to get all of them, but nobody actually has guessed Joan right, surprisingly. And we figured that was
That's
a
the easy
given.
one.
We gave you that one, but nobody has gotten that one. A couple of people have pointed out that there's 13 pictures, but only 12 names, and that is correct. That is part of the surprise that will be next week. We're going to have a special guest next week, and that will be more of a fun talking session. We're not going to have a topic to talk about. It's just going to be fun dialogue talk.
And we're very excited.
Yeah. So please, we need more input on the contest. Somebody has to win that.
I think we only have like maybe
Eight,
eight
yeah.
or 9 guesses.
Yeah.
And it's a good gift.
Yeah.
Get on there.
Yeah. Is someone having a baby?
Oh.
No, there's no more babies.
No more
in the
babies that we
water.
know of, Susan.
All right. So, and then we wanted to say thank you to the Water's Edge Salon and Spa in Derry for giving us this beautiful gift basket. That was so nice of them. They dropped this off for all of us to enjoy some nice hair products, and then we each get to enjoy service at their spa. And if you haven't been there, you should really check it out. It's beautiful. It's absolutely beautiful there. So thank you, Shelley, and everybody at the Water's Edge Salon and
Thank
Spa.
you.
It was a really nice thank you. You know,
Yes.
we do what we do because we love it. And we're so grateful when people appreciate. You don't need to do anything for us, but boy, we were really shocked and surprised at that one.
Yeah.
And they were thanking us for our customer service.
So that was nice. Thank you very much. So yeah, so tune in on Tuesday at 5 o'clock. Joan and Susie will be talking again. Maybe somebody else.
Yeah.
Maybe
Carrie.
Carrie.
Yeah.
Oh, Carrie's
No,
off on
Carrie's not
Friday.
here.
Tuesday.
Carrie wants to join in, but more want to join in.
Christy.
Yeah,
Yep.
Christy.
We nominate Christy.
There we go.
I wanted to tell you guys a dirty joke, but Joan wouldn't let me, so
Nope.
Maybe
That's
next
Tracy.
time.
Nope. All right. And listen, any questions that you have on prediabetes or diabetes, please submit them. I'll be more than happy to answer those for you.
Karen has a question.
Oh,
Is there any foods that help lower your blood sugar quickly?
quickly. Foods that lower
Protein.
them. No, it's all about, you know what, Karen? Our body always wants to maintain what's called homeostasis or steady state. Okay? So there isn't a one that's going to drop your sugar. What you need to do if you have a low sugar is you can take some protein along with a sweet, something not real sweet. Years ago we used to give sugar and orange juice. Probably not a good choice. Peanut butter and crackers or cheese are going to bring your sugar level back up and maintain that steady state. I don't know of anything that's going to drop it quickly. Sorry, wish there was.
But thank you for the questions. This is what we want. We want to be able to have a live dialogue. So
Absolutely.
keep with the questions. We like
Yep.
that.
Yep.
All right, guys. Have an awesome Friday. Have a good weekend.
Have a good weekend.
Enjoy.
Bye.
Bye.
Bye-bye.